If you're just joining us, happy Friday. Enter your name and your organization's name in the chat. We'll go ahead and get started, I think. Happy Friday, everyone. I can't believe it's March already. I don't know. Time definitely flies. I think we're going to kick things off with an icebreaker, but if you're just trickling in, please remember to enter your name and your org name in the chat. And if you can advance the slide for me, please. Basics on roll call. We love to see some faces. Jenna, nice to see you. We do have closed captioning. We do use AI transcripts. So if you're seeing that little button on there, that's why. We don't do anything with it, but it does help us keep notes and action items. And we'll go ahead and kick things off. I think I'm handing things over to you, Ryan, for an icebreaker.
Sure. Good morning, everyone. So, little creativity for this one. So you can put it in the chat, you can come off of mute, however you want to do it, but try to think of a word that describes you that starts with the same letter as your name. Could be any part of your name, but just see what folks come up with.
Ryan, do you have yours?
You think I would, right? It's really amazing. That's what mine is. Probably like responsible or something boring.
Responsible is definitely, that's a good one. Mine may be dynamic, but really it's mostly animated, not dynamic. Audacious, I love it. Helpful, very cool.
Java infused, that's a good one too.
That's me today. We won't even tell you what I did with my cold brew. Crafty, love it. Sassy, that's me also. I have even a sweatshirt, something about being spicy. Anyways, we'll go ahead and keep things moving along. It is definitely Friday in my mind. I'm ready for 5 o'clock. We've got a packed agenda though, so we'll go ahead and keep things moving forward. Great icebreaker, Ryan.
Thanks. So, yeah, we're just gonna jump. Let's see. Where are we at? Emily, I think you're up.
Hello guys, so we're going to do some updates and announcements right now. Excuse if you hear any little whisperings from 4-year-old in the background. My daughter had a half day today because it's parent-teacher conferences, so she's behind me doing things on her tablet. So right now, one of our top announcements is that we have a redesigned San Diego Pass CPI website. I will soon drop the link in the chat. But basically, we're hoping this website is a little bit easier to navigate for participants. I know our Intrepid Ascent and the DHCS website can be a little bit wonky at times, but this one will link directly to our calendar. It'll make registration links a lot easier because it's all Google incorporated. So that's thank you, Ryan, for putting that into the chat. So if you guys have any questions, comments, concerns, if you go and you click around and you're, looking around and you see something wonky or just have general feedback, please go ahead and email me at emily@intrepidascent.com and we will go ahead and work on it and try to optimize it for your usage, because that's what it's here for you guys. Okay.
Thanks, Emily. Yeah, this is sort of version 2 of that. We will be putting all of our other important dates, Calium Academy dates, and other resources here as well. So any of our meeting resources and one-pagers, tips, FAQs, all of that will be nested here under this redesigned website. And as Emily mentioned, anything that is helpful as far as feedback can be used to make some updates here. It's pretty easy for us to make updates. So this is one of the reasons that we changed to this. Definitely please share your feedback with us. I think you can go to the next slide for me, please. I think the rest of the updates are pretty quick. Virtual vendor fairs, for those of you who are looking at TA Marketplace, there is a virtual vendor fair. They've gotten through 2 of the domains. There are 3 more sessions to go. You do need to register, so registration is open for the 3 remaining. We'll send some updated information in the chat, and we have been through Slack as well. But for those interested, these sessions are available and they include all vendors across the TA Marketplace. Next slide for me, please. I think that's sort of just a basic. Oh no, this is a good one, Ryan. Why don't I kick things back over to you?
Sure. So not sure if folks saw or not, but DHCS released an updated ECM policy guide in February. And so just wanted to call out a few of the key changes to it. They didn't change the whole thing. But I think they're trying to streamline sort of service provision. And so I think one of the biggest things is in the past, Medi-Cal members were able to be in enhanced care management and targeted case management through the county at the same time. But they're moving away from that so that ECM is the goal is for that to be the primary service that people are linked to if they're eligible. And so they won't be able to be in both at the same time because there is a lot of overlap in the types of services. But so it will just be a matter of deciding, one versus the other with the idea that ECM should be the primary choice for folks if they're eligible and meet those criteria. And then local government agencies are encouraged to become ECM providers, and the managed care plans are encouraged to contract with them for ECM. So I think just for continuity, sake of continuity, and for the members and not having to continue to move around as much. The second bullet, I'm not going to pretend that I'm an expert in this, but basically dual eligible Medi-Cal members are eligible for enhanced care management if they're not enrolled in one of these other services and the alphabet soup that goes with that. So, and in the deck, when we send it out, there's a link to the updated guidance as well. And the nice thing about it is it tells you, right in the guidance when things were updated. So all of the changes that were made in February are pretty easy to find. And then one last key point is the coding guidance that DHCS released earlier this year. So the deadline for implementing those new codes is the end of March, so March 31st. And managed care plans are not allowed to require ECM and community support providers to use any codes beyond what is in the guidance. And so that, that'll be a key piece of it, is just making sure that folks are aware of the codes and what they need to do. And then RF, I see you have a question.
Thanks, Ryan. Really just wanted to put a finer point on the previous slide that you shared regarding the guidance from DHCS about duals. This is a topic that does come up quite often, and a lot of the plans we grapple with this on a daily basis. So it is important to note that for the most part, I would say most of our dual members are in one of these programs, meaning they're not in traditional, Medicare Advantage. They are in, an aligned DSNP or a non-aligned DSNP because they are Medi-Cal members. So typically when they enroll in as the Medi-Cal members, so when they enroll in Medicare, they would typically enroll in a DSNP. So it is important to note that those individuals are not eligible for ECM and CS, and that does not change, right? So it's just important to call that out because it is unfortunately a point of confusion. We get these cases come through a lot where individuals really want to be in ECM and CS, but they are in a DSNP, and unfortunately, they just wouldn't they wouldn't be able to enroll just because of the criteria that's set up. So I just wanted to call that out. That it is an important clarification from the state, but it doesn't really impact as many people as the folks that are in these Medicare programs.
Yeah, thank you for that added clarification. And I also wanted to sort of give any of the managed care plans on the call if there's any updates or anything that you wanted to share around any guidance for the new codes. I know some folks have asked about that in the past, and so wanted to just open the floor up a little bit to see if anyone has any, anything that they wanted to share about that. All right.
If you want to keep us moving along, I think we have just a couple of other community work group and events. We can table this from now, but just some upcoming dates. You'll see these also on the calendar for that website. I know we've got a couple of spotlights today, and I want to make sure we have enough time for that. So I'm going to hand things over to Joanna.
Hi, everyone. Good morning. Happy Friday. Let me just share my screen really quickly. Okay, can you guys see my screen? Okay, I'll be doing just a quick update in regards to some changes, some updates that we've been making here at 211, particularly around the CalAIM webpage that we have on the 211 website. So as you guys can see here, I'm on the 211 website, and I know that I repeat myself a lot with just how to navigate to this webpage, but just in case there's anybody new in this space. On our website here, we have this turntable that you can find CalAIM. We're going to be moving a CalAIM permanent tile to the webpage soon. But for now, and it's, sorry, a little bit difficult to navigate to it through this turnstile. But you'll see here that you can always access this webpage just by going to 211sandiego.org/cal-aim and find our centralized webpage here. So really the goal of this webpage is to take a lot of the information from the various health plans and just centralize it into one place. It's a little bit easier to access for providers as well as community members. And one of the tools that we developed was this comprehensive list of CalAIM providers that we're constantly working to try and get updated and as accurate as possible. And this is a live document that all other users have view access to it. I have editing access to it. So feel free if you guys are ever finding any of the information on here as not accurate or needs to be updated or isn't even listed here in the first place, please reach out to me and I'll show you guys how you can do that actually through the document here. But you can see here that we have this page here, which is just our matrix of providers. So it allows for you to filter by health plan, by provider, or by the actual program that you're trying to drill down on. So for example, if you're looking for a recuperative care provider in the community, you could click on this filter here, select the X. The X indicates that the service is being provided. And I'll just select here, see just mine, and it'll filter down and show which providers are offering those services and for which health plans. And if you want to filter down even further by health plan, you could click on the health plan, and then you can see the providers by health plan and by service. So most of you guys should be pretty well aware of this, just because I've shown this in the community a couple of times now. The new feature that's part of this document is our populations of focus. So a lot of the feedback that we've been receiving from the community has been related to this tool being really helpful and, really appreciated for the centralization of all this information. But the thing that was missing was related to populations of focus. Now that all the populations of focus for enhanced care management have been rolled out, we've been working on this tool to take all of that information and allow for you guys to do, very similar to the actual provider matrix, but being able to drill down on those populations of focus. So same structure, you can go into each population of focus, select which one you want to get additional details for. So for example, justice involved population of focus, you could click on that column, select the X, which indicates that the target population is being served. Click on See Just Mine, and then you can see that the providers that are offering those services to those specific populations of focus. This is still a work in progress. I'm still hoping the goal of my presentation today is that I can close up all the information on this tab here. And you guys will see here that at the top here, we have this CalAIM request form that will link you to a really simple document that all of you can submit anytime that you guys want any of the information updated on that spreadsheet. So for example, you can go into here, enter your organization, 211 San Diego. Are you an existing CIE partner? Yes or no, doesn't matter. You'll still get this screen here on the next page. And then a question around, I want to update my populations of focus. So it'll just go through the different categories of populations of focus. It'll allow for you to indicate which of the subpopulations you serve, so on and so forth. That will get transmitted over to me, and then I will make that update, same day or next business day on that spreadsheet. So just, if you are on our webpage and you are navigating, let me try to get back to my tab. The Zoom stuff is always covering everything up. So just one second. So if you are on the spreadsheet, and if you are able to, please do your best to just review the information on here. Feel free to review, the matrix information, the health plan information, if anything's changed in relation to your contracts with health plans. You can also fill that information out on the form. If any of the information here is new, if you're now serving, the birth equity population of focus, the justice involved population of focus, and that's not listed on here, then feel free to fill out that form. And if I have any questions or follow up, I will definitely reach out to you. It allows for you in that form to also provide me with your contact information. So that should just be a more simplified way for us to just make sure that this information, is as accurate as possible. And then the last thing I'll just say is, we also do have our database available on the 211 website. And this really is the source of truth, related to CalAIM services. So this allows for you all to, any resource that's available when anyone calls into 211 is also available on our public website. So our referral search does allow for you to drill down on specific needs, CalAIM services, populations of focus. So I would encourage you all to, if there's ever any questions about, whether your service is listed in our database, look up your organization, your service in our system, and that will provide you with all the details of, how your information is being presented to the community. And if there's ever questions about or, requests to update this information, feel free to reach out to myself. But if your resource is listed in our database, then that is something that our resource team at 211 is managing. And we have a large resource team that's, their goal is to really make sure that all the resources in our database are as accurate as possible. So you can always reach out to the contact that you have at our resource team. You can always reach out to me. And then we also have a CalAIM at 211sandiego.org email listserv that goes to a couple folks across a couple of different departments. So I'll just throw some of those details in the chat. I'll throw in my contact information, as well as the links to the different web pages that I showed you all. And then just feel free to let us know if there's any questions or feedback. But we're constantly trying to improve these processes, and always looking for that community feedback, because these are processes, systems, tools that we're creating to be helpful to you all. So we're constantly looking, what in ways to improve on that. So please don't be shy and feel free to reach out. And I will pause there.
Joanna, thanks so much for sharing that. And for those folks on, please make sure, we sort of doubled down when we talked, over 2023 on what resources are available in the community. And we said, as we measure success, and we talk about that in different ways when we talk about our North Star, our aim, and how we're going to continue to meet that over the course of the next few years and improve on the infrastructure that exists in the community. This resource was identified as as well as other resources in the community to say, we want to double down on what we have today that's available. So we know managed care plans, active participants have this information on their websites. This is a way for an individual to look at a single place and do some of that filtering by populations of focus, by managed care plans. So again, I encourage you, organizations, providers, please look at your information, do the best you can. We want to make sure that this stays updated and current. And the same is true for the managed care folks on the line as well. With that, I'm going to hand things over to Heather Summers. And I think, Emily, if you can reshare your screen. Heather's going to be talking with us about some updates under SD-AIM.
Thanks so much, Denise. So good afternoon. I'm Heather Summers. I'm Deputy Director with the County of San Diego Health and Human Services under Medical Care Services. I'm going to be sharing with you today a bit around our efforts under San Diego Advancing and Innovating Medi-Cal. I'll be sharing several items with you today. One is to just provide a level set with the SD-AIM roadmap, and then also from the SD-AIM roadmap that originated last May, it went to the Board of Supervisors, and from several listening sessions, where we're headed in developing and actually putting the roadmap into action. I also wanted to take this opportunity as well to give you a snapshot of our 2022 implementation assessment and key findings, and then also talk about two items where we received cited funding at the County of San Diego that also support our roadmap. So I have a half hour. I think each of these topics could easily take 30 minutes. So you're going to get a snapshot of them as we go through. I would welcome, any input in the chat or questions. You're also welcome to contact me as you will get a copy of the presentation as we move forward as well. All right, so why don't we start with the San Diego Advancing and Innovating Roadmap. Next slide, please. So to some of you, this should be familiar. The roles and the roadmap priority areas were developed from several community listening sessions and focus groups that were held in early 2022. And then the roadmap was presented to the Board of Supervisors in May of 2023. We also presented this information as well to Healthy San Diego and several other groups. So the overall role of San Diego Advancing and Innovating Medi-Cal is to facilitate county-wide response to service delivery issues, promote streamlined and standardized processes, cultivate collaborative partnerships, disseminate information, foster data sharing and infrastructure, elevate consumer-driven needs, and advocate at the regional, state, and national levels. Next slide, please. So this is our actual roadmap, and it looks like a road. And you're going to see in the orange box as well, there's an area that says more changes to come. The roadmap is very much a living document and something that can continuously be updated. So our county roadmap outlines 4 priority areas on how we will support the community. The first priority area is care coordination. So this includes promoting streamlined processes for member identification, referrals, authorizations, and strengthening care transitions. The second priority is enhanced care management and community supports. This includes assessing countywide services, capacity, identifying gaps, as well as securing funding for capacity building and infrastructure. The third priority area is the safety net. This priority focuses on strengthening social and clinical care resources and engaging community partners. And the fourth priority is Medicaid innovation. This entails identifying new service delivery models and best practices, driving policy and procedure enhancements, and advocating for policy changes. This really is meant to be and intended to be a high-level guide that leads us to actionable steps and impacts. And then these drafted areas have also helped us draft our action plan by using the identified priority areas in the SDA roadmap. So what you're going to see next is a series of slides around actionable steps and objectives related to these 4 core areas. This is a draft. And so I want to say that several times. You are the first group to see the drafted areas and objectives. So this is your preview and your opportunity to provide input and feedback. So we'll have 4 of these slides as we go through these. And again, if you don't get an opportunity or you want more time to sit with these materials, they will be sent out as well. So the first priority area is care coordination. So it's broken into 2 goals. One is to promote streamlined processes for member identification, referrals, and authorizations. And the second one is to strengthen care coordination. So objectives, as an example, would be to establish baseline data to measure service utilization, network adequacy in order to reduce disparities among Medi-Cal beneficiaries in San Diego County, access and standardize community referral and authorization processes to promote optimized health and social service support systems of care, from strengthened care transitions, establish the estimated number of individuals enrolled in and eligible for Medi-Cal while in a local jail or youth detention or reentry facility, and establish the estimated number of Medi-Cal beneficiaries in San Diego County. Next slide. The second priority area is around enhanced care management and community supports. So 2 goals. One is to assess countywide service capacity and identify gaps. And the second is to secure funding for capacity building and infrastructure. So it's looking at conducting a community assessment to identify service gaps using a population health approach, and to secure funding to increase capacity to support populations of focus. Next slide. Priority area 3 is the safety net, and that's 2 goals. One is to strengthen social and clinical care resources by facilitating meaningful conversations with stakeholders to determine how to strengthen clinical and social resources available for providers and community support systems of care. And the second is to promote strong engagement with community partners to cultivate opportunities to increase community engagement and input through public forums and outreach. And the fourth priority area, Medicaid innovation, to identify new service delivery and finance models and best practices, and develop a framework to evaluate the impact of different Medicaid models on quality, access to care, and value, to drive policy and procedure enhancements, to engage and empower all stakeholders in opportunities to share their voice and lived experiences as new DHCS initiatives evolve, and to advocate for state and federal policy changes, to identify and address legislative proposals that may impede the advancement of SDAIM and its goal to support underserved communities and beneficiaries of Medi-Cal in San Diego. And we can go, there's actually a fifth priority area. I misspoke saying we had 4. So let's hop on over to the 5th one around data and evaluation. And there are 3 goals. One is to participate in a regional data sharing framework. So to participate in activities to advance data sharing to support care coordination. The second one is to identify the impacts of CalAIM on community health and well-being. So to publish information to track and trend Medi-Cal population demographics, characteristics, and health and well-being data. And then the third is to share successes in areas of opportunity to continue advancing health equity, and to evaluate available data for a quality indicator report to support identifying areas of success and opportunity to continue advancing health equity. I know that was a lot, covering 5 in rapid fire. I did just want to connect with this group as you're seeing this. Is there any particular priority areas that you would like to review while we have time today, or to focus on one to provide input on? We had care coordination, enhanced care management and community supports, safety net, Medicaid innovation, and data and evaluation.
Folks, feel free to enter that information in the chat or come on off of mute. We're a friendly bunch. It's Friday.
And if it's feeling like a fire hose today too on a Friday, I apologize.
Heather, I think maybe why don't we, for the sake of a non-response here, why don't we go ahead and have you pick?
Okay, sounds good. So let's, well, why don't I do this? So if we, Emily, just to go back to priority 2, this will tie into a bit into the presentation as well. When I talk about 2 of the upcoming assessments that we've recently procured, you're going to see a direct connection to this particular area for enhanced care management and community supports. So that's one area to keep in mind as we start to go through the presentation. You're going to see that theme a little bit heavy today in the presentation. And then you will get the slides and an opportunity to look at the goals and objectives as we move forward. So keeping in mind with that theme, if we could go and advance ahead to the San Diego County CalAIM 2022 implementation assessment. All right. So I wanted the opportunity really to come in and bring to several areas And thank everyone who participated as an enhanced care management or community support provider in between 2022 and 2023 in a series of listening sessions. The listening sessions in many cases were simultaneous with our community listening sessions to really expand and develop our roadmap and our priority areas. And we also had at the time health management associates who were working on looking at initial implementation assessment and key findings from enhanced care management and community support providers. So this slide here highlights several of their findings from that initial overview on gaps, needs, and barriers. And you're going to see the top 6 areas as we embarked on CalAIM. One, that it was a cumbersome process. So at times there was lack of adequate provider training on systems and program details. Services were also identified to be an administrative burden on program management. The second area was benefits and eligibility. Members had trouble keeping documentation that proved they were eligible for service. Certain eligibility thresholds were difficult to meet. There was also difficulty at the beginning to translate social needs into billable codes. For the workforce, experienced difficulty hiring and retaining appropriate staff for program needs. Funding, there were initial funding delays and reimbursement and cash flow concerns by many organizations and contracted providers. Data and information, there was limited information regarding provider networks and the inability to identify and track social drivers of health. And then for Medi-Cal procurement overall, there was uncertainty and instability. Next slide, please. So health management associates also identified several areas for opportunity. So the most common identified opportunities for improvement were to increase incentive payment for outreach, standardize and standardization of processes across health plans. There was a request by providers for more robust education to increase awareness about enhanced care management benefits and community support services. And then additional factors that were identified that could increase enrollment in enhanced care management and community supports and easily connect clients with services was a suggested countywide dashboard to track health and community outcomes, an information technology governance infrastructure platform and systems to support providers, and more supports for community-based organizations to become and remain contracted providers, including adequate funding to carry out the work, which could also include increased provider reimbursement and incentive payment for outreach. So let's go to the next slide as well. They also identified, HMA did, best practices across the state with early implementation. And you'll see that there were 4 counties that were also identified to have best practices. One was in San Francisco County, where the health plan designated a point of contact to respond to and troubleshoot technical issues. The second was in Orange County, where CalOptima offers presumptive eligibility for certain community support services. Another was Alameda County, proactive outreach to enroll members and direct role of staff. Los Angeles County, the MCPs collaborate to administer a common enhanced care management and community support provider certification process. And then other areas that really impacted best practices throughout the state was really looking at model of care, business processes and program workflows, partnerships and collaborations. And I will say in San Diego County, we are seen as a best practice in many of the collaborative areas that we roll out, particularly with Healthy San Diego and our strong partnerships between the plans, community-based providers, and just our efforts really to come together as a county and to really be collaborative around problem solving and really thinking outside the box on and how we can really contribute as a group and as a county, a real commitment to serving our Medi-Cal population here. So that is the snapshot of the HMA overview. If you do want further details on the results of that assessment, we do have a separate slide deck that can be requested, and you can have further details on that particular assessment. Why don't we go to the next slide? So now I'll get into a bit on the area that we had focused on that came up on the action plan or under care coordination, where I'm going to be discussing two current assessments, and these did go out for requests for proposal, and both were procured. So the first one we're going to focus on is going to be the CalAIM Medi-Cal Transformation, our Enhanced Care Management and Community Support Readiness and Infrastructure Assessment. So why don't we go to the next slide? So the purpose of this particular assessment is really to look internally at the county. I heard Ryan talking earlier about our public health nursing and in-home support services, in-home visiting, and new guidance that had come out from the state on what could be billable visits regarding TCM, targeted case management visits versus enhanced care management. So as an example, when we go into this infrastructure assessment, we're looking internally at the county of how services are currently rendered and any areas that could be impacted by CalAIM for billable revenue as an example. So we have an internal assessment at the county in really looking at assessing the County of San Diego's existing ECM and CS-like services and current infrastructure. So this includes a look at staffing, case management and outreach systems, data sharing capability, billing systems, referral processes, and identifying critical gaps and needs to prepare the county to contract with Medi-Cal managed care plans to provide ECM or CS services, and to assess Medi-Cal transformation's impact on current programs and provide recommendations to address potential impacts. This can also include identifying services and county community health workers that currently provide services at the county that may be Medi-Cal billable. Next slide. So Health Management Associates is currently completing this infrastructure and assessment. And they've also begun to work similarly with many California counties on similar projects to help them prepare for CalAIM implementation. And so you can see that there's 4 different areas here where they're looking at services and models of care, operations infrastructure, staffing infrastructure, finance, contracting, and funding. Now, we're anticipating that this process will take us through the end of the year as we start to complete and roll out and understand areas that may be needed to look at, such as our public health nursing in-home visits, could also include First 5, There's changes in Prop 10 funding through tobacco tax. What does that mean? And where might there also be areas, even with the birth to 5 and birth equity areas, and even in first 5 services, where there could be billable opportunities. So really taking a deep dive into many areas as we embark on this readiness and infrastructure assessment. All right, let's go to the next slide. So the next one I'm going to discuss will be our CalAIM Medi-Cal Transformation, Enhanced Care Management and Community Capacity Assessment. So next slide. So the goal for the community capacity assessment is to assess capacity for eligible Medi-Cal members to access enhanced care management and community support services, to identify gaps and barriers to service, and to propose strategies to ensure Medi-Cal members across the region have access to enhanced care management and community support services. And this was also a recent procurement as of February, and we have partners in Eviset are currently working on this community capacity assessment. And when we originally embarked on this, tying to that second action plan and our roadmap, really was with intent to look across the board at our entire San Diego County region and really see where do we have the majority of our Medi-Cal members? How are they distributed throughout the region? Out of our Medi-Cal members, are there certain, pockets or areas or communities where maybe there are community supports or enhanced care management services or other social services that are really missing? Are we able to adequately get the word out and really reach all of the different cultural areas, languages that our families are seeking or meet their unique needs? So that was part of the goal for this particular assessment. Next slide. So there are 4 key areas here. One is to co-design the assessment. So you will see engaged stakeholder groups in the development of the work plan. The second area is to define enhanced care management and community support provider universe. The third is to assess enhanced care management and community support capacity. And the last area is finding and recommendations. I will say overall, Eviset, who's working on this, is working very diligently. Their goal is to pull as much public data as they can. I know, and from this group, there's been a lot of questions around service fatigue. This is an area that we do have cited funding and really want to look at the region overall. You play a very important role in that, in really understanding, are we helping to reach all of our Medi-Cal providers and really have a good understanding from a mapped out level, making sure that our social determinants of health are engaged, that our nearly 1 million Medi-Cal recipients are able to be reached. So we will end up having a short, brief survey. And I did want to bring that up to this group as well. And this is the first time that we've been presenting on this and really introducing it, and more to come as well. And happy to continue to take any questions on any of the materials covered. You're welcome to email me, put anything in the chat, and our team is here to really be responsive. I know I put a lot of information and really provided a lot to you today, and thank you for all your active participation.
Thank you so much, Heather. I really appreciate absolutely. Christy, Heather, can you share that information in the chat? You saw that. And we have this
can.
deck, perfect. And we have this deck, it's all incorporated, and we'll be sharing that with folks after today's session. Heather will make sure that we share your contact information and the rest of the contact information from today's presentation. Thanks. And Emily will have all of that packaged up and send it to everybody. We'll send it via email probably sometime next week. And remember, we do share in the Slack channel as well. Ryan,
Heather, is it Heather?
Go ahead.
Sorry, just clarifying the name of the consultant that you shared in the chat. There's two different consultants, or?
Yeah, the primary consultant is Partners, and then they brought in Evaset, and they are two separate organizations. They're just working in conjunction.
Okay, and Partners, that's their full name, or I'm just.
Their full name is Partners in Care.
Got it. So that's the Partners in Care Foundation that out of Los Angeles.
Correct.
Okay, thanks.
Thanks again, Heather. We really appreciate you sharing what is happening under SDAIM. I know we're gonna talk about AIM statements, for 2023 and 2024. I'm gonna hand things over to Ryan here in just a second, but I wanted to just thank the managed care plans. Managed care plans in San Diego are sharing information with us quarterly. And without that information, we'd be having a full year almost look back. So we're able to kind of see where we stand for 2023 at the end of the year. So we got that information from managed care plans, and we're going to go over that today. Did we hit our aim for 2023, Ryan?
Yes, we did. And so I can, I'll show that in just a second, but just as a reminder for new folks who may not be as familiar, earlier in 2023, the group came up with an AIM statement, which you can see on the screen. I'm not going to read it all to you, but basically it was to increase enrollment in ECM and community supports throughout the year. And so we did get data from all 4 of the managed care plans throughout the year. And so we were able to have a fairly good representation of what the data is showing for this year. So if Emily, if you want to go to the next slide. All right, so this is for enhanced care management. And just to give you a little background on the slide, the presentation of the data. So the yellow orangey bars are the numbers of people who are enrolled in enhanced care management as reported by the MCPs. And so this, for each quarter, it's all 4 of the MCPs. And so you can see that number went up, quarter after quarter, which is positive. The blue bars represents 5% of the total enrollment of Medi-Cal members. And I think that is an estimate from DHCS about the number of people approximately who would be eligible for enhanced care management and community support services. The green bar shows you the percentage of people enrolled over the number of potential eligible. So, 41%, a little over 41% of the eligible population for ECM is enrolled. So that's positive. And then the red bar is just what our goal was. So our goal was almost 32%, or approximately just under 15,000 members. The 41.26 actually represents, it's the 17,307. So we exceeded that for ECM. And then if you want to jump to the next slide, Emily, for community supports. So you will see that as a collaborative, you also exceeded the goals for community support. So that's great news for the community. And so what we want to do now is really think about what do we want to focus on for 2024. And so after looking at the data, we've drafted a potential aim statement for 2024 that it's still focused on enrollment, but what we want to do for the next few minutes is do some breakout groups and talk about the changes to the aim statement, if it even seems, to get your thoughts about it. Is it reasonable? Do we need to make it something different? So we really want feedback from the group. You will see in the first little sentence there that we've crossed out some language. Basically, we did that because there's not really a way that we can measure whether or not we're actually doing that as a community. And so, we haven't replaced it with anything yet, but that's also something that we want to talk with you about, is maybe rephrasing that part of it. What would make sense to go there, something that that we can measure and track to determine whether or not we were actually meeting that. And so that's kind of what we want to do for the next, I don't know, maybe 15 minutes or something. Just we'll do some breakouts and talk about this and get thoughts. Again, we sort of made some estimates with these numbers. So if folks look at it and say, oh, we can do more than that, then that's great. We can certainly change it. But we just thought this would give us a starting point for the conversation. Anything else, Denise, that I missed? Or
No, I think that covers it. I mean, we recognize the numbers are still not where we want them to be, right? As a county, as a community, and as a state. But I wanted to just, acknowledge that we were able to hit the aim that we identified for 2023. And I think that's sort of a good way of teeing things up, Ryan, are these numbers too low for 2024? Do we need to look at, increasing that threshold? And I think just to reiterate from the managed care plans, they will continue to provide us those reports quarterly. So it will be helpful to us throughout the year. This is data that we actually do have access to. And I think we can move right into our breakout groups.
Yep.
Emily, are you moving us?
Yeah, sorry, I'm choking on a pretzel.
Oh my goodness. Well, don't do that.
Okay. So 2 breakout rooms or 3?
It depends on I think you have a kiddo at home. So why don't we do 2? It's not ideal, but we'll manage.
Okay. One moment here. Opening up the rooms.
Thank you so much, Emily. Hey, everyone, welcome back. I'll do a quick share out, and Ryan, maybe I can pick on you a little bit for a quick share out. But I know we didn't have, it's not like we had an hour to sit with the data today. We'll definitely share the data with this group as we do quarterly, and it'll have some more granularity. It'll still be an aggregate for all of the managed care plans, but it will include more granularity on community support by, community support service, and some population of health information as well. A couple of things I'm hearing is, enrollment numbers are still really low. Enrollment for Q4 in general overall did go down. So that could be, some of why we hit our numbers. So things that we'll want to explore. We're also kind of up against redetermination and this is, I think, especially important in San Diego, MCP transitions, right? Because San Diego, we are all still, I think, probably living through it, including the managed care plans on the line. There was a huge number of beneficiaries that moved off of Aetna and off of Health Net into one of the 4 remaining plans in the county. So something that we're going to need to pay close attention on too, for our Q1 and for our Q2 numbers, is those overall total numbers of beneficiaries. And we'll also try and do some work to cross-check some numbers with the county. Ryan, do you want to do a quick share out?
Sure. Yeah, we, I don't think we got super far, again, because we sort of ran out of time, but I think people were agreeable in kind of removing that first part that we had talked about, but also making sure that we are able to somehow look at the equity component of this. And so, exactly what that looks like, not sure, but I think that was something that we talked about. And then, folks are just asking about the types of data that is available and do we have demographic data? And so I think for this, we've, it sounds like that's not necessarily an option, but yeah, so I think, yeah.
Yeah,
Lost
and I
my
think
train
what
of
we
thought.
can, that's okay. And I think what we can do too is we'll circle back with the county. We had Chris present to us last month on some of the things that were available and being reported through the county. And Lynn, maybe I can circle back with you and come back to this group, but we want to look at data that we have available to us, but we also shouldn't, say, well, then there's no other way, right? We are, in a unique position in San Diego. We have a community information exchange. We have the county. We have 4 managed care plans who are always at the table. And we have a health information exchange. And so, we may have more data available to us than we realize. And so we also have a data standardization and a data work group. So these are conversations that we can bring to this group and then circle back to the group at large. I know we have a couple of minutes left. We'll share some additional thoughts around secondary aims. So maybe like looking at our big aim, sort of our pie in the sky, our North Star, something that maybe we can measure, but some other opportunities that may be available to us in sort of secondary aims. Maybe we could put together a goal for some specific populations of focus, and maybe we could put together a goal for some specific community support services where we see more than an unusually low utilization. And so we'll look at that and talk more about it in April. And we'll also share the graphs for all of the roll up with this group after today's session. We didn't have a chance to put all of that together, and also recognize, I don't know that everybody wants to spend time going through 10 pages of graphs, but we'll poke and prod at those numbers as well. I'm going to ask you to go one more slide for me. Thank you so much. And I just want to call out two things as far as upcoming events. We just talked about the CIE and the Health Information Exchange, the QHIO, the Qualified Health Information Organization in San Diego. They are doing a informational webinar under our Calium Academy. And that is going to be next week. So if you haven't registered for it and you are interested in it, please, please, please register for that event. We also have a few other events under Calium Academy. So we'll be sharing registration and dates for those as well. But the CIE and the Health Information Exchange are going to be talking about data that's available under both of their platforms and how they will work together to bridge between the CIE and the Health Information Exchange, San Diego Health Connect. So that is next Tuesday again. We're going to keep moving forward on Test of Change best practice playbook and some of the things that we talked about in February that we wanted to push forward for this quarter and for Q2. We'll be revisiting some of that as well. And we'll be doing some of that and more of this conversation around our goal, our Test of Change, and what's going to drive us there in our April meeting. So if you haven't already registered for April in person, please, please, please register for that event so that we can feed you. And also we want to know, like, what's going to get you there. Please join us for the 19th. And what do you want to be able to get out of it? What would be one thing that you hope that we could achieve when we get together in person next month? I don't see anybody's response. I don't see your responses. They are, they'll come in and they'll go over to Emily as aggregate. We're going to do the best that we can to take the information that you're sharing with us and make sure that we can try and hit it home on the 19th. Can I make everybody's dreams come true for the 19th? There is no guarantee. I mean, I'm certainly going to try. But without this information, we're going to shape the day however we think or assume you'll benefit. So please, this information is certainly going to go a long way to help make sure that we make this event meaningful for you all. What else are we going to do on the 19th? We will feed you, we swear. We do have some time for networking. We also recognize that a full day for folks is a huge commitment. We've tried to structure the event in a way that if you need to shave off time at the beginning or end, you can do so. We have networking built into that event. Save the date went out. We'll share agenda information as soon as we have it available. I only have 6 responses here, folks. 7, okay. It just tells me 7. Okay, now I see 8. Also, office hours, they're April 11th. They are shared for just a quick reminder, those are shared between San Diego and Contra Costa. We're also talking to our facilitators in and around San Diego region. So other CPIs, so looking at a regional approach, recognizing that people don't sit within the the boundaries of the county. So we are talking with our fellow CPI facilitators to see how we can partner together and share information and content. And we'll look to other ways that we can collaborate over the course of the year. Just 3 more minutes left. I just have 8 responses. Please
Emily
definitely share. Go ahead, Emily.
I was just gonna say Emily did put the link to the registration link in the chat as well if you didn't see that. So if you're not registered, there's an easy way to do it.
Thanks for that, Ryan. All right, folks, we're at a wrap. I want to thank you for spending the time on Friday. I know it's a crazy busy day and probably a crazy busy week. So thanks for making the time. It's important, and we'll keep moving things forward. We'll share all of this with you after today's session. So thanks again. Have a great Friday and a wonderful weekend. Oh, shoot, I forgot the satisfaction scale. See, maybe I did that intention. Was that like, yeah, no, I'm kidding. Yeah. Tell us what you think. Are we doing a good job? Are we failing miserably? I hope we are not failing you all miserably. We really love spending time with you all. So we'll keep up the good work. And if we're doing a really bad job, let us know so we can do better. Especially Emily. I mean, come on. No, I'm kidding. It's me. I've had way too much coffee today. Have a great day, everybody. And we'll stay on, Ryan. We can stay on, answer any questions anybody has. I should have shared with everybody my coffee snafu from today. Maybe I'll put it in the email that we send out. For those folks that are still on the line, hey, Nicole, nice to see you. But not see you, but nice, nice for you to join.
I know. I'm sorry. I'm off camera. I was traveling all week, so I just got back later than I expected to last night. So I'm off camera, but great facilitation, great meeting.
Thank you so much. Thanks for joining us.
Yeah, I'll talk to you soon. Take care, all.
And are you ending
Veronica?
my polls?
Uh-oh. Veronica, I see you're still here, and Matthew, I see you're Veronica is just still here, but if you have a question for us and you want to ask, we're here to answer. Otherwise, we recognize you might be multitasking.